I'm talking about my experience from Guinea about the outbreak, Ebola outbreak. The classical outline. It is the worst Ebola outbreak actually in West Africa. And the figures are very highly important. I was deployed in Guinea as expert for infection control from the official start of the epidemic in March, the first day in March 2014. To date, I had 2 visits to this country from March 26 to April 25, then from July 17 to September 23, 2014. The objective, to assess the quality of the response to infection control, to propose relevant recommendation to suit the current and future responses. The methodology was to evaluate. Evaluation have been carried out in decision-making bodies, crises, at the operational level. In decision-making bodies, I was part of cell of crisis, and I was able to estimate the chair dedicated to IPC, considering the activities in the general response. At operational level, during the first day, assessment was made in some facilities. The first primary facilities, very quick evaluation of response capacity to the outbreak was used. WHO tool assessing implementation of basic measures for IPC. At the hospital, regional hospital, application of the IPCAT hospital tool, IPCAT infection prevention control assessment tool. At the national level, the Ministry of Health, application of IPCAT national, WHO tool. And then observation practices and staff interviewing always completed these activities. During the second stage, my first concern was what was the impact of the achievement of the first day. The activities were staff training directed for organizational measures for trial and case management. Quick evaluation, observation practices, and staff interview at operational level. Evaluation of IPC activity at the national crisis. Root cause analysis by organ methodology performed in a care facility where several infections of healthcare workers were reported. The organ methodology was very important for me. It is based on data collections, chronological ranking of the data, data analysis to identify causes and factors contributing, providing relevant corrective measures to prevent such events for the future. Result, we are going to see the result for this situational analysis at the beginning of outbreak. Impact activity. The activities are continued after I leave, obviously. IPC activity at national crisis and the result for organ analysis. Situation, initial situation. Basic measures for IPC were far from being implemented in facilities. The IPCAT H at the regional hospital showed a performance rate of 43%. At national level, the performance rate was of 30%. And in decision-making bodies, IPC activities were not visible and IPC were not really concerning. The situation during my second stay impact of the activities, the impact was very poor, and no significant changes in professional practices. At national crisis, unlike, I found a national prepared response providing an important component for IPC activities in facilities. The Orion analysis, the facilities were not prepared for a sound management of cases. There was no local action plan in the facilities, implementation of basic measures, triages, management of suspect cases before transfer. We are discussing the situation during the first stage, the second stage, and after recommendation will follow. During first stage, performance rate found likely overestimated because in the context of panic and confusion, I didn't check the result of the interview. Hence, the importance of the interview staff and observing practices. Positive points were the project to establish a national program for patient safety and appointment of a national focal point at the Ministry of Health in Guinea. All the activities on IPC were deployed in the Ebola treatment centers, implemented by MSF, but they were autonomous and separate from overcare facilities. There were physical, technical, and psychological separation between the two sectors. It was difficult for me to speak about IPC in the meetings of crisis, and it was more difficult to implement IPC activities. During the second stage, the situation has changed, even if no significant changes in professional practices. My feeling was there was an awareness in importance of IPC in all facilities, especially beyond the Ebola treatment centers, because 99% of healthcare-associated infections were reported beyond Ebola treatment centers. And awareness, there was also awareness in the shortcoming of training staff without over support measures. Training is only one component, but it is an essential component, but is only one of the components of the response to IPC, to the outbreaks. During the second stage, 6 months, it was amazing, 6 months after the official beginning of the epidemic, no health facility still had a local plan to deal with the epidemic. It was really amazing. Results and recommendations from the Orion analysis were shared widely in the country to more raise awareness about how healthcare workers get infection. Finally, I was obliged to tell all the country to explain the healthcare workers are getting infection because it's not their own fault. It's the fault of the system because in the healthcare facility where there was no action plan to face epidemic. The recommendation in the emergency, there is a need to setting up a triage system in each care facility. 6 months after the starting epidemic, there is no triage. In emergency, developing an isolation area to isolate suspect cases pending transfers to the Ebola treatment center. In short term, implementing administrative and organizational measures to implement in sustainable manner standard precaution and contact precaution in all facilities. All the recommendations have been in the form of a roadmap with details on the way and means to carry out various activities. And now this roadmap is available in all Guinean facilities in the country. Implementing recommendation, a wide supervision training were performed all along the country to have a working meeting with executive in the facilities. The roadmap. The roadmap is comprised of administrative and organizational measures like hygiene and security committees, local coordinators, working group. In Guinea, we set up 2 working groups in each facility. Working group for hand hygiene and use of PPI, and the second was for the environmental hygiene. The aim was to comply with all technical recommendations, standard precaution and complementary precaution. The technical part of the roadmap was focused on standard precaution and complementary precaution, and with especially hand hygiene. The technical activities were to perform situational analysis, to make an action plan, to increasingly reduce gaps, and to perform monitoring and evaluation. And all WHO tools were provided to the facilities. To perform this supervision training, the constitution team was me, National Focal Point of WHO, Guinea, National Focal Point of Ministry of Health, to continue the work after I leave. The outcome of the missions. All the Guinean facilities, national, regional, and district hospital, regional and prefectural directories of public health currently have a roadmap, and the executive with administrative and technical leadership, I'm saying about the director of the facility, the coordinator patient safety of the facility, are trained in the way to conduct the roadmap. The perspective is a first progressive approach, step by step, but the necessity to support other facilities not covered by the supervision training, health posts, private facilities, because patients go in all facilities in the country. Elaboration and implementation of a supervision grid with adapted indicators, because the supervision training has to be continued. Even I'm not here, the local executive have to continue supervision. It is very important to continue the training supervision, either by national, regional, and prefectural level. IPC component is weak in the outbreak response, especially in facilities for standard care. There is an urgent need for facilities to face effectively the epidemic and prevent healthcare associated infection. After the emergency phase, the need is to continue the work started to build a permanent and strong security system in care. And the national program could be very helpful. The main challenge to overcome can be summarized on one sentence: creating local conditions in facilities to implement sustainable professional practices in accordance with technical recommendations. And it is the aim of the proposed roadmap. Now, to finish, I'm going to share with you very quickly some pictures from Guinea. This illustration is the unsound management of healthcare waste. The car for transporting patients with Ebola. Healthcare workers training in how to use PPA. The set of PPA provided by WHO. Okay. Training. in how to use PPA. This is a regional representative for WHO in Forestier, Guinea. Ebola Treatment Center in Gekedu in Forestier region. I'm training in Make Africa Orange. This picture is very important. Here is the local coordinator of patient safety of the regional hospital in Zerekore, capital regional of Forest Guinea, where started the epidemic. He was a great commitment in patient safety, and he wanted to work with me after the epidemic for patient safety. Unfortunately, he was died by the community. He's died. He was killed. He was killed. He was killed some days before I leave Guinea. There was an official mission with the regional governor for sensitized population, but in some area in Guinea, there is a very, very, very resistance, very strong resistance to. It is important. It is why you say it is very important to involve community. Training, supervision with executive is the most important component of the response. Because the executive have to take important measures. WHO regional providing PPA in health centers. After training IPC, the audience were very, very glad, and everybody is clapping hand because they are starting to understand many things. And more, they accept to go in Ebola center. It's a real problem for healthcare personnel, healthcare workers to be appointed to the Ebola treatment center. I saw a director hospital. He was obliged to appoint some personnel for the Ebola treatment center. He was not able to appoint personnel. Airport of Kisidugo in Forest region. This airport was very active during the outbreak. MSF, very green country. Thank you for your attention.